Hi, this is Dr. Kronowitz, and welcome to What's Hot in Plastic Surgery. This segment, I'll focus on how I manage facial rejuvenation. The first component that I consider is the use of skincare products. The way I use skincare products is to keep the face moisturized and to use light chemical peeling, and also to use very good agents that protect the skin from sun. And this is very important to any type of facial rejuvenation approach. The first approach involves the use of toxins or botulinum toxins, as well as the use of fillers that are called hydroxyapatite fillers. In my practice, I typically use these in combination. The approach is to fill the upper face and to get rid of the animation of the lower face, which looks for a rejuvenated, youthful appearance. Much of what happens when we age is that much of our volume or tissues in our upper face fall down and descend into our lower face, which leads to the creation of many of the elements that as we age, most patients do not like. So the idea and the approach I take is to use fillers in the upper face, also to get rid of many of the wrinkles that occur. Wrinkles occur because of the muscles. The muscles attach to the face, the skin of the face, and as they pull or contract, lead to wrinkle formation. So the idea of using the toxins is to paralyze or partially paralyze these muscles that lead to facial animation, so that we don't see the wrinkles or the creases as prominently. Unfortunately, much of the injection that is done out there is done improperly and injects really way too much element without really using it in the way of an art and a science. And many of the patients I see end up with absolutely no facial animation, which I don't think is very natural. So the idea is to weaken these muscles in order to maintain animation, but get rid of the wrinkles and the frown lines or the squinting lines or lines around the mouth. So that in combination with the fillers, which can have a very dramatic effect, especially in the upper eyebrow, for instance, can lead to a very youthful appearance along the jawline, and certain in other areas can really enhance an appearance. So those two in combination are pretty much the most straightforward approach to facial rejuvenation. As we get a little bit more complicated, but still a relatively minimally invasive approach, I like to use a combination of autologous fat grafting and chemical peels in order to serve as another level of facial rejuvenation. The fat grafting is harvested in relatively small volumes, either from the lower extremities or the hips or the thigh area. It's filtered, resulting in just the stem cells, some blood vessel material, and some of the fat cells, and then is injected into the deep compartments in the cheek area, which leads to a very youthful appearance. Not only do you get volume enhancement in that area, but it has a rejuvenating effect on the skin itself. Instead of trying to remove outer layers, we actually rejuvenate the skin from the lower layers and even the musculature and soft tissues by injecting the fat into the deeper planes or the deeper levels of the cheek area. I usually will combine this with chemical peels, which are extremely effective and been used for many years, and in my opinion often are more effective than the use of some lasers. As we get to the most complex and certainly an area of very exciting area of facial rejuvenation is surgical rejuvenation. There's several different components that are related to it. I'm going to try to touch upon each one individually and then let you know how they're combined. So let's start with the forehead. So the forehead, the objective is to get rid of the wrinkles of the forehead and to try to get rid of the muscles that lead to frowning in between the eyebrows. And we could do this either with a minimally invasive approach, which is very typical. We remove the muscles and we elevate the forehead in order to get rid of the wrinkles, but we have to be very careful not to raise the hairline too much. Other approaches that are utilized, which are more classic techniques, involve the use of making incisions within the scalp or even in front of the hairline. Again, it really depends on each patient's needs. Now let's talk about the eyelids. The eyelids is a very exciting area and doesn't really need to be combined with any of these other procedures. It's often performed either alone or combined with other procedures, including fat grafting to the midface and chemical peels. There's been a lot of changes and different thought processes in doing the eyelids, which is referred to as blepharoplasty. Essentially, we remove fat. There are fat compartments within the upper eyelid and within the lower eyelids. We remove the fat, and then we'll remove some skin. It's very important not to remove too much skin from the lower eyelid. This leads to some problems in patients. And the upper eyelid skin we have to be relatively conservative with as well, especially if we're going to do a forehead lift, because a forehead lift will automatically remove some of that skin that would otherwise be removed from an upper eyelid. In some patients, we need to also tighten the ligament on the outer eyelid in order to bring the upper eyelid up. This can result in a very rejuvenated appearance, but can also be overdone. So it's very important that you go to somebody who's very experienced. Now let's talk again about the midface or the cheek areas, which is one of the most important areas besides the neck to many patients. Like I discussed, there are several ways that this can be handled in several minimally invasive ways, which include the use of injecting filler or hydroxyapatite fillers in a deeper plane, which has become more popular lately. The use of fat grafting, which I use extensively to increase volume and to rejuvenate the midface. And then I do a very exciting surgical midface lift where I elevate the midface tissues up onto the high cheekbones in a very exciting and minimally invasive manner, usually in combination with a brow lift. I will inject some fat graft at the time of surgical midface correction, cheek area. Then let's talk more about the actual facelift. What is a facelift? Actually, the facelift entails tightening of the skin, especially the skin of the neck, and many patients require a facelift to get rid of the excess skin of the neck. In addition, we will often tighten the muscles of the lower neck and excise some of the fat that protrudes through the muscles in the lower neck. The muscles of the lower neck can become lax over time. Often that can happen in our abdomens or our stomachs over time, where we get a little bit of a bulge. So essentially we excise some of that fat and tighten the muscles in the center and on the outer areas. In addition, we do some tightening of the deep layers of the face, which is called a smash lift, which is something that I think is very imperative in doing all my facelifts. And then a very important part is to trim away excess skin, but to do it in a very conservative manner so that we have a very natural appearing, rejuvenated and youthful face upon completion of surgical rejuvenation. So this is a lot of information, but essentially let me summarize. In my practice, facial rejuvenation essentially has 4 components. One involves the use of skincare products, which is very important for protecting the skin, for keeping the skin moisturized, and for very superficial peeling of the outer layers of the skin that keeps it rejuvenated, as well as nourishing the skins with various vitamin preparations that are available within my office. Then we get into the area of using fillers and Botox, which I like to use in combination. I approach this in a very artistic manner, as opposed to just injecting at specified points, as is approached by many other practices that perform this procedure. The next level of facial rejuvenation, I do fat grafting of the midface. I inject stem cells and blood vessels, which fills the midface, the cheek area, and also rejuvenates the skin in the deeper planes, and we'll often combine this with a chemical peel, which is extremely effective. And also, this is also a great opportunity to perform eyelid surgery as well as a third component. And of course, the most involved area of facial rejuvenation, which can lead to the most dramatic results, is surgical rejuvenation, which involves surgical rejuvenation and of the forehead, the cheek area, the neck, and excess skin. Again, these are used in various combinations depending on the patient's needs. Facial rejuvenation is something that is a continuum and continues to need to be maintained over time. depending on when a patient presents on their age, they may require one versus the other, and will receive other components depending as they go along throughout their life. Well, I hope this was informative to you, and I would love to see you in my practice to be able to see which approach to facial rejuvenation would be for you. Well, this is the end of this segment on what's hot in plastic surgery, facial rejuvenation. I look forward to seeing you soon, and thank you for joining me.